I got pregnant when I was 15 years old. I had her by the time I was 16. It's been a roller coaster. I was 15 when I had my son. I wasn't planning on it.
I was super tired. I was nauseous all the time. So the pregnancy was like horrible.
We did talk about birth control and all that stuff. She said that she was on the birth control and everything. Even if she was on the pill, it messed it up, so we ended up with a kid.
We were using birth control. We're using condoms, but I guess something went wrong and I was 14.
How are you today?
I'm great. How are you doing?
I'm doing good.
There's a much higher percentage of teens who use contraception when they have sex. So about 90% of teens who have sex are using a contraceptive, but most of those teens are using short-acting methods that are not very effective, like condoms and birth control pills. Condoms are great at preventing sexually transmitted infections, but they're not great at preventing pregnancy. Really high typical failure rate at a year, about 18%. So about 18% of teens who use condoms will become pregnant in a year using just that method. For birth control pills, it's about 8%. So 8 of that 100 women will get pregnant.
So my boyfriend and I are thinking about becoming sexually active, but we're definitely not ready to have a kid, so what should we do to prevent that?
Well, let's talk about some contraceptive methods. So the answer is really the long-acting reversible methods. With IUDs and implants, it's 1% or less. So 1 out of 100 women will become pregnant using those methods. And the implant is actually the most effective reversible method. What's so great about them is it's a forgettable method. There's nothing that teen has to do. It's an in-office procedure. It's a small bit of anesthetic in the arm that's delivered by a needle. It's literally a second, and then that implant is placed into the upper arm. The girl doesn't even feel it. That's literally a less than 1 minute procedure. The IUD is a little bit more of a project. It's a pelvic exam. Reversible means that if that teenager wants to get pregnant, or if she just doesn't like the method, it can be removed. The removal is also an in-office procedure. But if that teen wants to get pregnant, let's say 2 years later, and the actual method lasts for 5 years, she can become pregnant as soon as the implant or the IUD is removed.